dietitian for many years and have been working with bariatric surgery patients since 2010. And my talk will be on weight loss and diabetes. And I know that you would probably want to know what the bottom line is and how these two conditions are different or the same. So first I'm going to give you some diabetes statistics. And if you can see this map of the world, you'll see Southeast Asia on your screen. And it shows on there that in Southeast Asia, about 75 million people have diabetes. About 84 million adults are living with diabetes in the International Diabetes Federation Southeast Asian region, or approximately 1 in 12 adults. And this is expected to increase to about 156 million by 2045. And of those people who have diabetes, about 58% of them in the Southeast Asian region are undiagnosed. And in 2017, about 1.3 million deaths were attributed to diabetes in the same region. So in looking at the top 5 countries in Southeast Asia for diabetes, India is actually number 1 at about 75 million, followed by Bangladesh, Sri Lanka, Nepal, and Mauritius. So I know that it's very important for you all to learn more about how to deal with diabetes and obesity that is also increasing in India. So some of the obesity facts worldwide, it actually has tripled since 1975. And in 2016, about 1.9 million adults or more, 18 years old or older, were overweight. And of these, over 650 million were obese. 39% of adults age 18 and over were overweight in 2016, and 13% of these adults were obese. And most of these world's population are in countries where overweight and obesity kills more people than underweight. 41 million children under the age of 5 are overweight or obese in 2016, and over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. So now there is this dilemma of facing a double burden of disease in many low and middle income countries, where even though there's problems with infectious disease and undernutrition, they now are also experiencing an increase in non-communicable disease risk factors like obesity and overweight, especially in urban settings. And it's not uncommon to find both undernutrition and obesity existing within the same country, household, or community. In India, diabetes, as you know, is becoming common among people belonging to lower socioeconomic groups, but most of them living in urban regions, especially in the more developed states. And on average, diabetes was twice as common in urban areas than in rural areas. So I'm going to be comparing the obesity recommendations versus the diabetes recommendations. For obesity, still the recommendation is to limit energy intake from total fats and sugars, increase consumption of fruits and vegetables, as well as legumes, whole grains, and nuts, and engage in regular physical activity, about 60 minutes a day for children and 150 minutes spread throughout the week for adults. This has not really changed, and I actually just came back from the American Society for Metabolic and Bariatric Surgery and attended the full session, went to some of the meetings and presentations on diabetes and weight loss recommendations, and I didn't see many changes in what's being recommended right now. It's still pretty much the same. Some of the diabetes facts, like I mentioned earlier, it has is an increasing problem in a lot of countries, including India. I'm from the Philippines, and it's also a growing problem in my home country. And people are becoming more obese because of the presence of conveniences, junk food, fast food, and decrease in physical activity as well. And worldwide, the number of diabetes has risen from 100 diabetes patients has risen from 108 million in 1980 to about 422 million in 2014. And it's been rising more rapidly in middle and low income countries. It's a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputations. And about 1.6 million deaths were directly caused by diabetes. Almost half of all the deaths were attributable to high blood glucose occurring before the age of 70. And the World Health Organization estimates that diabetes was the 7th leading cause of death in 2016. So for diabetes, the recommendation is still healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use. And that helps prevent or delay the onset of type 2 diabetes. The International Diabetes Federation recommends for primary management of diabetes and metabolic syndrome is a healthy lifestyle, which includes all of the strategies I had already mentioned. So like I mentioned, simple healthy lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. And so those include achieving and maintaining a healthy body weight, being physically active, eating a healthy diet, avoiding sugar and saturated fats. And the one difference between what I've tried to look into as far as differences in recommendations for diabetes and obesity is that for diabetes, it's also recommended to avoid tobacco use, as smoking increases the risk of diabetes and cardiovascular disease. So is it harder for people with diabetes to lose weight? There are two main reasons why it might be more difficult for people with diabetes to lose weight. And one of them is insulin resistance, because when you have insulin resistance, it can increase blood insulin levels, which may lead to fat storage. And also the use of anti-diabetes medications can cause weight gain, for example, insulin and glyburide. There are also other medications that people use now that can also cause an increase in weight. And the increased use of medications also increase with increasing age, decrease in household income, and also their self-reported worsening health status, which makes them increase medications that they take. Medication use is increased 17.3% in people of normal weight. It's increased 33.9% in people with class 3 obesity, or people with a BMI of 40 to 49.9. And some of the major medications that can cause weight gain are beta blockers, anti-diabetes medications, antidepressants, and anticonvulsants. So this is actually an older article that I found that compares weight loss and the effect on A1C between people with diabetes type 2 and also those without diabetes. And you can see the people who had participants in this study that had weight loss diet alone lost weight 5.3 pounds in 6 months, and in 12 months, 5.7 pounds they decreased their weight by. In 12 months in subjects without diabetes, if you'll notice, they actually lost more weight than the ones with diabetes. When given medications, again, the people with diabetes didn't lose as much weight as the ones with without diabetes. And the last medication on there was actually a medication that has been banned in Europe in 2009, and it was never approved in the United States because of its side effects of suicide, and then also for depression. So this is a list of some of the medications that are currently used for weight loss. Orlistat or Xenical is used, and without a prescription, it's available as Ally. For a while, it has not been in the market as much, or at least marketed as much in the US, but it's coming back and having sort of like a resurgence. You can see some ads of it again in print. Belviq is a newer drug that's also being used now for weight loss in the United States. And phentermine and topiramate, this is a combination drug. The brand name is Kissing. Okay, so in our clinic, we actually do medical weight loss as well, in addition to weight loss surgery. And these are some of the drugs that our patients are put on, and it's usually the physician's assistant who works with the patients on weight loss medications, and then the dietitian is also included in the program so that the patients will have the nutrition counseling that they need in order to have both medication therapy and nutrition therapy to help them lose weight. We use these drugs sometimes on patients who either are preparing for weight loss surgery and need a little bit more help, as well as patients who have lost weight through weight loss surgery and have regained some of the weight back. Sometimes insurance issues here in the United States can be a problem with trying to put patients on newer medications because insurance may not cover them. I'm not sure exactly how in India that is as far as if patients wanted weight loss medications, if it is actually patients are able to purchase these medications. So newer classes of drugs for diabetes that can also help with weight loss include the incretin mimetics or GLP-1 agonist, dulaglutide or Trulicity, once a week medication, the extended release form of exenatide called Bydureon, taken weekly. There's Ozempic, also taken weekly, and then liraglutide or Victoza taken daily. Now, liraglutide or Victoza actually has a weight loss medication that is used mainly for weight loss and not for diabetes called Saxenda. It's a higher dose medication. It's not really labeled for diabetes, but I know that in some cases, some of our patients are on Saxenda because they need to lose weight, but they also have diabetes. And I've seen patients actually lose anywhere from 10 to 13 pounds on this in the first month or so that they're on it, and patients are satisfied with that. It decreases their cravings, makes them feel fuller so that they're not eating as much. It helps with people who tend to graze during the day or crave at the end of the day or at night, at bedtime. And so it really is very helpful in our patients who are trying to avoid those situations where they just tend to want to eat food either all throughout the day or at the end of the day. So what should we recommend? 5 to 10% weight loss is still the recommended amount for people to lose. And then also continuation of the lifestyle strategies that led to the weight loss. Inclusion of physical activity. And the recommendation now is not just for aerobic physical activity, but the inclusion of strength training or muscle building exercises to help the patients build more muscle and improve their calorie burning or fat burning. And then consideration of the use of anti-diabetes medications, which also promote weight loss. Like I said, in our clinic, we use some of these drugs to help our patients with pre-diabetes or diabetes to help them lose weight as well, and then also control their blood sugars and improve their A1C, especially pre-operatively, so that they can have a better outcome after surgery. Okay.
Thank you very much. And our mic of my laptop will not be able to pick up the round of applause. So I just communicating to you that people are very grateful to both of you for having taken up time and woken up early morning. And I would leave Maria to go back to sleep.
Hi, Dr. Beg.